In community healthcare, making information available at the point of care can deliver significant benefits, increasing efficiency and greatly enhancing the quality of treatment the patient receives. Dell and Intel have joined forces to help primary care trusts to evaluate and quantify these benefits, thereby helping them to make well-informed investment decisions on empowering their mobile clinicians with the necessary technology.
I came involved because I'm passionate about enabling nurses to be able to do their job more efficiently and effectively. Having seen what technology can do and how it can move sort of nurses forward, freeing up some of their time which they can then put back into patient care makes it essential that we actually build this and make it happen. The project in Nottingham started a few months ago now to actually see, will people use mobile technology? What are some of the difficulties and concerns that they may have using it? Do clinicians want it? Is it workable? Does it improve care to patients? And is it more cumbersome than it's worth?
Hello.
Yeah.
Morning.
Morning.
How are you, Elizabeth?
Not so bad.
Not so bad. Good. Good. Where it does come in useful is where if one of my colleagues is off, holiday, sickness or anything, and I get a call about one of their patients, then actually having the record there with mobile working, I've got their patient's record there as well. And I can access that, and I've got the information instantly for that, so that I can see where it would really benefit there.
In fact, the trial found that the clinicians were able to complete patient notes far faster using the mobile working solution. 96% of them completed the same day as the appointment, and performance was up across the board, with clinicians reporting productivity gains in excess of 25%. But it's not only the clinicians who benefit from having on-the-spot access to this information.
How are you doing?
Oh, not too bad.
Good.
While I'm with a patient, as well as using the mobile working to record my interventions, we've got the facility to actually demonstrate to the patient how things have changed over a period of time. So we might look at weights, we might look at blood results, and it's a very visual demonstration to the patient.
I mean, I know my blood pressure is low, but it's nice to see it on the screen.
And at least we know it's stable,
That's
even though it is low.
Got it there, haven't we, you know?
Yeah, it is.
So, yes, it is good.
It's fantastic.
So it's really easy just to show that to the patient to enable better discussion and better understanding.
As well as enhancing patient care, mobile working significantly cuts the amount of time clinicians have to spend travelling, meaning both more time spent with patients and less stress, and an enhanced work-life balance for the clinicians themselves.
Now with mobile working, because I've reduced my travel time, I've been able to use that time to have increased clinical contact. I was having to keep coming back to the base frequently during the day just to keep up to date with the records.
Hi Lisa, you alright?
So I'd come back to base at the end of the day. That would be sort of an hour and a half at the end, often in my own time, and then I'd have to commute back home.
So where before clinicians had to return to base to complete patient notes, book appointments and access systems and email, with the mobile working solution they could access these resources from anywhere, cutting travelling time by up to 32%.
I just think it's brilliant, and for me what sold it to me is not the devices, but when the actual nurses and clinicians themselves told me how much it improved their time that they could spend with patients, how much more in control they were around their patients because they had the information all to hand, how they were able to have structure their plan before they met the patient, which meant that the interaction with the patient was much more meaningful and useful. There's real excitement within the profession to move this forward. All I'm trying to do is to facilitate and support so we make it happen, and we make it happen soon.